Hi everybody, welcome to the live feed. Tonight I'd like to welcome you to the Residential Home Care Network live presentation of Ask the Provider. I'd first like to thank you for joining us tonight. My name is Carolyn Pagel, and for the next 30 minutes I'll be talking about several things. But let me tell you first a little bit about the Residential Home Care Network. Hi Wendy, thanks for joining us. Hi Chris, thanks for joining us too. The Residential Home Care Network is a nonprofit group of 16 beds and under adult family care homes as well as assisted living facilities that provide personalized care for Florida families in a private home-like setting. The adult family care homes are licensed to care for residents of 5 or less in the home. And the best part about these, which is one that I own, is an adult family care home, is the owner and administrator lives in the home with the residents. Like the adult family care homes, the assisted living facilities, they have 16 beds or less. And when you have these type of homes, you tend to have a more personal care given to the residents that live with you. As some of you already know, many times the large corporate facilities don't have the staff, and the residents don't always feel like they get the attention that they so rightly deserve. And of course, we all know one big problem with the larger facilities, while it's great to have them, there tends to be a lot of turnover in them. And I'm proud to say our residents enjoy the services that we delivered by the caring and compassionate professionals that each of us hire and have in the homes. They're all professionally trained by the owners, and we hand pick all of these. Hello and welcome for joining our page. We've only been going for about a year, and we've quickly grown to 3 chapters, and we're just now adding our 4th chapter. Right now we are in Orange and Seminole, Lake County and Osceola, and soon Marion County will be joining us as well. Let's see here. Well, welcome and thanks for joining our page, our live feed. While I'm thinking of it, I wanted to let everybody know everybody's invited to join our monthly meetings. We hold our monthly meetings at One Senior Place in Altamont Springs the first Thursday of every month, and I'd love to invite everybody out there to come join us. It starts at 12:30 and goes till 2:30. We usually have lunch, and we get to talk about what's going on with everybody the first little bit, and then we get down to business and talk about what's going on. If there's any changes in the industry, is there anything special that we need to share with everybody? And a lot of times somebody will come in with new input, things that have happened in their facility that helps us all kind of come together and help each other in the group. Now, lunch is served. All the regular members of the group, I'd like to let you know there's no charge. Non-members, there is a $10 fee, but this is to cover your lunch. And we love to have everybody come out and join us. We're slowly but surely growing, and as we add to the facilities that are within our group, it's just going to get bigger and bigger, and I'm sure we'll all be able to work together. The best part about this group that I found is if there's something, me being new only a year into this, that we need to talk about, I can reach out to the other members of the group and we can talk about it. Now tonight, my topic that I'd like to talk about, we've already talked about what's the assisted living facilities and the adult family care homes that are in the group. But tonight I'd like to tell you a little bit about what's the difference between the skilled nursing facilities and home health companies. They're with the skilled nursing facilities, those are, say you fall, you have a resident or a family member that falls and possibly breaks a hip. Depending on your doctor and how he feels about what's the best for you, you may end up going to a skilled nursing facility. And if you end up in a skilled nursing facility, there's one thing I'd like to stress about being placed into a skilled nursing facility. You have to qualify for this. And to qualify, that means you have to have three consecutive days of stay in the hospital. This can't be an observation. Sometimes you'll go into an observation holding pattern at the hospital, and that won't meet Medicare guidelines and Medicaid guidelines to get you into a skilled nursing facility. Now, what a skilled nursing facility is, when I first graduated from nursing school, I worked in a skilled nursing facility, and we offered everything there. We offered regular skilled nursing for people that lived there year-round. That was their home. They required to have the skilled nursing at the bedside. They needed speech therapy, physical therapy, as well as being overseen by a medical director that came to the site. With the skilled nursing facilities, you have to qualify to meet the required guidelines to be in a skilled nursing facility. And say you go to a skilled nursing facility for a fall, and you're placed in there. With Medicare and Medicaid, you are only allowed for up to 100 days stay that will be paid for. Now, after the first 10 days, there's also a copay that is sometimes required, and those can be fairly steep when you're talking about copays to stay at the facility to get the therapy that you might need. Now, at your skilled nursing facilities, they have private rooms, but Medicare and Medicaid will only pay for a semi-private, which means you're going to share a room with someone. These, while you're staying at the skilled nursing facilities, your meals are provided. You have breakfast, lunch, and dinner, as well as you also have snacks throughout the day. You have the skilled nursing care that's there. Say you have a wound, you have somebody there to take care and tend to your wounds during the day. But it's there, and you're there for 24 hours up to a day, up until the time for you to be discharged from the skilled nursing facility. Along with being there, you have physical and occupational therapy, speech and language pathology services. The medical social worker is there. They can also help you get help outside of the facility. Say you're coming up at the end of your time and you might need extra care at home when you go home. These social service departments, they can help you get what you need when you do go home. Another part of this is medications. They monitor your medications. Your medications are given to you at the specific times by the nursing department. All your medical supplies and the equipment that is in the facility is the facility's equipment. Now, say you have a wheelchair or a walker, of course you can bring that with you. You can use that, as well as your own clothes and everything like you'd be at home, but you'll be using their beds and everything within the facility. Another thing that they have available for you is ambulance transportation. Say something happens and you're not feeling up to par like you should be, you're not progressing like you should be, and you need to transfer back to the hospital. Well, if this happens, one thing about this happening is, and it's key to remember, if you get transferred out and you go to the hospital, the time comes for you to be released from the hospital after your stay, you may not have the same bed. You may not even be allowed to go back to the same facility. It's dependent on the beds that are available in the facilities, and these facilities tend to fill up pretty quick because the people that are there for skilled nursing or physical therapy. So the beds tend to fill up pretty fast. Another thing that happens while you're in the skilled nursing facility is you have a dietary counselor. This is somebody that works with your doctor and with your medical needs to make sure that you're getting the correct food that you need. Say you have hypertension. Well, if you have hypertension, well then that's going to mean that you definitely need a low salt or no salt added diet. Say you're diabetic. With diabetics, one thing I hear, I'm a diabetic. You have to really monitor your sugar. So you'll have the monitoring that's going on as well as the special diet that goes along with it. Now, with, as I said before, if you do go to the hospital and you are released from the hospital, you may not get the opportunity to go back to the same facility, or if you do go back to the same facility, that bed that you were in with the roommate that you were sharing and got to know, they may not be there. You may be transferred to a whole different facility. So that's something to keep in mind. Now, with the skilled nursing facilities, they also don't just do therapy. They have long-term skilled nursing facilities. The one that I worked in, the residents, and they lived there. These were their homes. They needed round-the-clock care. They needed somebody to monitor them, to take care of them, and they did not meet the criteria for, say, an assisted living facility. There's some different criteria that makes it to where you can live in an adult family care home, such as mine, or in an assisted living facility. So all of these things that you talk with your doctor, they'll be able to explain what's the differences and what your particular needs are. Now, as for your home health, say for example, once again, you've fallen and you have broke your hip, and you go to the skilled nursing facility, and after a week or 10 days, you meet the first 10 days, and then your copay kicks in, and you're responsible for maybe $150 a day copay. That's kind of steep. So you may opt, if you're up to it and you feel like it's something you can do, and you have preferably, hopefully somebody at home to help you out, you may opt and talk to your doctor about home health care. Now, home health care, this isn't somebody that comes in and stays 24 hours a day with you. This is somebody that comes in and they, depending on what your doctor's orders are written for, they may come 5 days a week, they may come 3 days a week. And with the home health care, what they do is, depending on what the doctor orders, they also have the nursing that comes, and they can set up your med trays. They have the somebody that can check and make sure that you're eating what you're supposed to be eating. They'll check your diet, make sure everything's done the way it should be done. But they also can provide you with the physical therapy that you're going to need to get you back up to your own levels that you were at before whatever it was that got you in the hospital that has kind of taken you down a little bit. Hi, Sharon, and welcome to our live feed. Now, with your skilled nursing facilities, that's a good question. The skilled nursing facilities and your skilled nursing facilities, they usually have a lab that will come in and do the labs for you at the skilled nursing facilities. Now, as for hello. As for your home health companies, I'm not really sure if they do have the lab companies that come out. I know that we have, I'm going to be speaking about one of our partners that work with us here at the Residential Home Care Network, and they do come to the home and do labs. Now, with the home health care, they'll have scheduled appointments that will come out. They'll talk with you about, and you'll first have a nurse that'll come out. They'll go through everything that is needed for you. Once they've come out and met with you, they'll go ahead and start checking to see, what prescriptions that you're going to need. They're going to go ahead and set up timing that the staff is going to be coming out to meet with you. Say you have a wound, they'll have a wound care nurse that will come out and change the bandages and treat what's going on. They will coordinate the care, which means besides coordinating care, they're going to communicate with your doctors regularly, and anyone else that gives you care. They're all going to work together with a care plan to make sure that you're getting everything that you need, that the doctor has ordered. And as I said, with this type of home health, for myself here at my adult family care home, I've had to have the home health come to the facility instead of sending my residents out to the hospital, or when I had a resident that came back, she needed some physical therapy, she needed some strength therapy, she also needed some occupational therapy. These are all things that home health care companies do for your residents, and they can do for you. They work with them one-on-one and at a regular time, and they get to know the resident while they're in the home, taking care of them. I'm trying to make sure that I've covered everything with this. They also do a lot of education. That's the one thing that I can tell you about the home health care representatives that were in our home taking care of my residents. They did checked with the wound care. They gave a lot of education, not just to the resident and the patient, but also to the families as well. They do intravenous and nutritional therapy. They do injections, say they need B12 injections or anything like that. They monitor for any serious illnesses, and they also any unstable health statuses that are going on. The goal of the healthcare team is to treat the illness or the injury that's going on, so you can regain the independence that you had before your whatever altercation that you've had that has brought you to this. And one thing about it, it is a Medicare benefit, so whether you choose a skilled nursing facility or you choose a home health company to come to the home, just talk to your doctor as to what's going to work best for you, if it's something that you or a family member needs. There are a long list of different companies out there, different facilities out there, different home health companies that are out there, and your doctor usually has a list of ones that he works with that coordinate the care together. They talk to each other, they work together very well. Now, on that note, I'd like to tell you about one of our sponsors that I was just talking about a few minutes ago, one of our partners. We have one I'd like to talk about tonight is the name of the company. Let me get my little papers out here so I can make sure I tell you everything I want to talk to you about. They're called Bluestone Physician Services, and the best part about Bluestone Physician Services is they started up realizing that there was a special need. It's hard, especially if you have an elderly person, to get up, get them loaded up, get them ready to go. I know I have one resident, every time she has to go out and go see a doctor, her blood pressure goes right through the roof. So what I'm checking here as her blood pressures, when she gets to that doctor, her blood pressure is a lot higher. We tend to call that white coat syndrome. Now, with Bluestone Physicians, the sponsor I was telling you about, their mission is to bring the highest quality health care directly to the resident, directly into the assisted living communities, the memory cares, and the group home communities. They are designed to focus and coordinate on comprehensive on-site care for high-need residents or individuals in these assisted livings, adult care facilities, adult care groups. Physicians access and communicate easily amongst us as providers, as well as if they set out to. Hi, and welcome to our live feed. the physicians, they communicate with the resident, they communicate with the facility when they're in there, and one of the best part about this is their medical teams, they visit on a regular basis. They come once a month, they meet with your residents, meet with the family, and they go about this in a preventative manner to reduce the need to rush off to the emergency room for hospitalization visits, and just to basically focus on overall improved health for the resident. I just dropped my paper, I'm so sorry. Now, as for the benefits for the patient, is a high quality of individualized health care in a safe, familiar environment. Like I said, my one resident, every time you say she's got to go to the doctor, her blood pressure goes up. When they come into the home here, you don't have that increased anxiety of having to go and having to be in a different atmosphere. The primary care goes over all of the issues that are going on. You don't just have to go to the doctor's office and see just different things. And that's one other thing, thank you for asking. If the resident needs blood draws or x-rays, they come and do it. They have the whole team set up for you. Now, for the families, the families can be right here, or if they're not able to be here, they can also talk to the facility, the different in-home staff, so they can communicate with the families. They set up and have more quality time. With this group, they have doctors, nurse practitioners, nurses, all of these people that travel and come around to the different facilities. Now, the benefits for the facility staff is, once again, the continuity of care. They can collaborate with the healthcare providers who understand the residents' care system. They also have an ongoing support and education for the facility and the community staff, so they can go ahead and make sure that they've got everything covered. They and yes, they can utilize e-scripts directly to the pharmacy, so you don't have any problems with when they write the order for a new prescription. You've got that all taken care of. It goes right to e-scripts. It's already done. If you don't want to use the e-scripts, you can use your own pharmacies, depending on what the resident's needs are. Another part about having the ability to have the blood draws or x-rays, you don't have to get them up. They don't have to worry about it. So say they need a fasting. That way the labs can be here early in the morning before breakfast is even served, so you don't have to worry. They can be right in their bed, go right to the bedside before they've gotten up and had a bite to eat, which ruins the lab draw. Say they fall and you think maybe they've broken something. So if you call up Bluestone, they send the x-ray team out right away. They do it right where this resident's laying in the bed. They go ahead and take care of everything. Now, with another thing with you don't have to sit in a waiting room. You know how it is sometimes in some of the doctor's offices you go to. I know, as for me, I've been to a couple of the doctor's offices with some of my residents, and you wait and you wait. Well, this way you don't do that. That appointment is made, you know, on such and such day, your resident's doctor is going to show up from Bluestone, and they're going to be right here. They don't have to wait around. They can go about doing their activities that they would normally do on the activity schedule. You don't have to worry about waiting in the doctor's office or loading up or scheduling training. Now, let's see here. I was going to tell you, their core staff, of course, is, like I said, they have the physicians, the nurse practitioners, core care coordinators that handle all the different things that go along with it. The physician assistants provide in-home customized medical care for complex, frail, and special need patients. So that's one thing I'd like to tell you to remember. Bluestone Physician Services, they're a dedicated team that really see the need to make sure that the residents are taken care of, and they're not just going through the doctor's offices. They come right to the home. They get to know the resident's schedules. They get to see where the resident lives. So it's more of a personalized one-on-one with these doctors at the Bluestone Physician Services. And now I did want to mention again, for everybody that was a little bit late coming in, we do have once a month for the Residential Home Care Network. We have a meeting. It's in Altamont Springs at One Senior Place. I'd love to invite everybody to come on out. It's the first Thursday of every month, and it's from 12:30 till 2:30. Members are free. Non-members are $10. We have lunch. We sit around and talk the first 20-30 minutes and find out what's going on with everybody within the network. And then we get down to business and we talk about how to make our network better, how to work better together, if there's any new information that we need to hear about or talk about, and ways to work together to make it better for everybody. Now, as for me, I'm going to give you a quick little rundown. I opened my little place called the Retreat of Winter Garden back in May of last year. And I did this because I knew that for me, I had been the administrator for a large facility, and the corporate offices just didn't look at it the way I did. I looked at them as people, and they looked at them a little bit different. They were more worried about the bottom line. And for me, when I'm a nurse, and I quickly realized that it wasn't for me about the money, it was about the person sitting in the living room or in the chairs in the facility. And I got started in healthcare because of a family member, like a lot of us get started this way. And for me, it was an eye-opener when I had my family have problems with different organizations within healthcare. I chose to walk away from a large facility, and I opened up my own adult family care home. I live here with my residents, and the best part about it is you get to know them. You get to love them. It's like having grandma in your home, and I couldn't have a better job or ask for a better life. And I know my residents get the attention and the love that they need and they deserve. Now, I want to tell everybody, yes, let me send you out here our email. You can write to us or check out our website. It is my goodness, I just missed it. www.residentialhomecarenetwork.org. You can catch us there, as well as you can email us. And I'm sorry, it's asktheprovider@gmail.com. That's the email. And again, www.residentialhomecarenetwork.org. And if you have any questions, you're welcome to go ahead and email Ask the Provider, and ask us what questions do you have? What would you like to hear about? Is there a topic that you'd like us to cover? We'd love to answer your questions. I haven't had a lot of questions tonight, but we'd love to answer your questions if you have any. If you have any suggestions of things that you'd like to hear about, just let us know. We'd love to talk to you. Again, I thank you so much for joining us, and please join us at our first Thursday meeting at One Senior Place in Altamont Springs on the first Thursday of every month. Come out, talk with us, get to meet us, get to know us, and we'd love to share what's going on within the industry, within the 16-bed or less adult family care home or assisted living facilities and the adult family care homes. I thank you again for coming out here tonight and listening and checking us out. I would love to see you at our next meeting. And thank you so much for joining us. And we'll be back here next Thursday. Please invite anybody that you'd like to invite to join us. And send us your questions or send us your topics you'd like to hear from us. We'd love to hear from you, okay? Now, thank you so much. And I hope to see you guys at the next meeting, first Thursday of every month at One Senior Place. Thanks a lot. Have a blessed night. Night.